Hello and welcome to At the Heart of Health with Dr. James Marcum. In today's well-marketed world, it's hard to know who or even what to believe when it comes to healthcare. In each program, Dr. Marcum, a board-certified behavioral cardiologist, takes a balanced approach using common sense modern medicine and the ultimate source of truth, the Bible, recognizing that at the heart of health is love.
I'm Dr. James Marcum, and welcome to Heart of Health. You know, in the news everywhere right now, I'm hearing about healthcare legislation, new bills. Patients are coming to the hospital. They're confused. They don't know what to do. When they come to the office from the hospitalizations, they don't know whether this is going to be covered. Basically, there's a lot of confusion. There's been a lot of questions also coming into our ministries, heartwiseministries.org. Today we have a guest that has some experience in legislative issues. He's an attorney. I've known him for years. He's my patient, and I'd like to welcome Art Rhodes to Heart of Health. Art, thanks for being here.
Thank you, Dr. Marcum. It's a great honor.
And could you just sort of tell us what's brought you to this stage of life? What makes you qualified to answer any type of questions from viewers today? You know, they watch all these healthcare programs out there, and we're talking about it on Meet the Press. What gives you any credibility at all? Now, I can only say that to a friend.
Well, I appreciate that. You know, the interesting thing is that I come to this from a couple standpoints. One, I grew up in a home where my mother was a nurse, director of nursing for a number of years. So, you know, you always have that inside source there. But outside of that, from a legislative standpoint, I spent a number of years, over 10 years, in Washington working as chief of staff to a member of Congress. That happened to be a good friend of mine, a gentleman by the name of Mike Parker, a good Republican congressman from the state of Mississippi. Mike asked me, he and I grew up together, and asked me to serve as his chief of staff. So at the very end of the Reagan administration, I went to Washington to work with him and to serve as his chief of staff and as his legislative director. So during the 90s, I had the opportunity to participate in, at that time, what was called Clinton Care.
Okay.
And so we were very involved in the process of trying to, I guess, this nation. Some thought it both good and bad.
Okay. Now, where you're working now, you work as an attorney for the Benefits Board. And does that have any health care implications? I'm sure your members use health care.
Well, I work with an organization called the Church of God Benefits Board, Inc., and it's primarily our operation there is to provide investment and retirement services for ministers and those who work in church-related organizations. But one of the big things we always deal with is the health care needs of those folks, because primarily once they go into a distribution status in their retirement, the big issue that they face is health care. And as you know better than anyone, the health care costs that seniors face today are astronomical. And oftentimes just one health care crisis
Takes away their savings.
Takes away everything they have spent 50, 60, 70 years trying to accumulate. It's gone.
Wow. Now, I met you a few years back, and you know, the first time we met, it didn't go over so well. Remember that?
No, you're going to have to tell me about that.
Remember, you came in having chest pain.
Oh, well, you know, I guess sometimes we don't want to talk about the times when we're in pain and,
right.
And
I see, if I remember correctly, you'd gotten on a trip somewhere,
right.
And then you came back with chest pain, and we made the diagnosis in the office.
Absolutely. Using our friendship privilege there, I guess, I had gone on a trip and had some very severe chest pains. And as a matter of fact, on a couple of occasions during that trip, my wife had tried to get me to go to the emergency room, and you know, I'm one of those hard-headed patients that you know about. And I said, no, I'm gonna wait till I get back home. And couple of days later, I was back home and called you up, and you said, you need to get into the office right away. And I went in, and as you recall, I was in a whole lot of pain.
You were hurting.
I was hurting a lot. Thought I was having a heart attack every second, and I think from you just looking at me, you said, no, it's not the case. But I have to say, I think you saw several things that I wasn't seeing, and one that I had, I don't want to say an obesity problem, but I was a little bit overweight. Mm-hmm. And after a little bit of diagnosis, you determined that I didn't have a heart issue. I had kind of a pulled muscle in my chest cavity. But I remember very well what you told me, and I've told a lot of people this since then. You said, Art, you know, you can treat your condition with either medication, and if you take the medication, you're going to be on it pretty much for the rest of your life, or you can use a different form of exercise, primarily pushing back from the table a little bit. And so that started me on a journey. Mm-hmm. And over a period of about 2 years, I lost almost 100 pounds, around 90 pounds. Mm-hmm. So I have, the task over the years has been keeping it off.
And it has stayed off.
It has stayed off. I went from weighing about 305 pounds. I'm a big guy, 6'6", 6'7", mm-hmm. but 305 pounds is still a big man. Down to today around 215 pounds.
Yeah, and I think you look healthy too. Well,
I feel healthy. I just keep telling people I'm going to make a good-looking corpse, I guess.
Well, we're glad you're here with us today, and after this short break, we're going to answer questions that have come into our website, and our website's heartwiseministries.org, and we'll be right back after this short break.
So here's a question. If you love Jesus, and I mean truly love him, people will notice, right? I mean, if Jesus is at the center of everything you do, people will have to notice. And that is exactly what Life Talk is all about. You see, at Life Talk, our goal has always been to connect people to the true source of power, Jesus Christ. We know with Jesus at the center of our lives, nothing is impossible.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
You can easily spend $90 on an expensive meal out. How about investing $89.94 in your future? Just think about the possibility of coming off those prescription pills and getting rid of all the side effects. Think about feeling better than you have ever felt in your life. This is all possible for you. For only $89.94, you will receive a 7-part DVD series, Weight Management by the Book, a 30-lesson workbook with over 100 recipes, and if ordered today, exercise tubes will be included for free to help with your journey. There are many programs available, but this unique program has identified the truth about how to manage weight. This program is not available in stores. This limited offer will not last long. Pick up the phone now and dial 877-504-9628. Operators are standing by. This call will change your life forever.
Two words for you. Pop quiz. Ready? Name any funny movie. A drama. Name a mystery. And one more thing. Name the movie your kids saw today in science class.
Know what really matters. Know about your kid's school. And know about your kid. Find out 100 ways to know more, do more.
Welcome back to Heart of Health. Today we're talking about an issue that's going to affect all of us. It's the relationships between the government and our health care. And I think we've learned, Art, that personal responsibility is a great place to start, not only about your own health, but also become involved. And that's what these questions are all about here.
Well, personal responsibility is the key to everything. We've got, in this country today, the statistics show that we have around 47 million people that do not have some type of health care.
Wow, that's a lot.
47 million folks. But the startling part about that is if you look at those statistics, up to 11 to 12 million of those people are eligible for some type of health insurance and are just not taking advantage of it. So they are not exercising the responsibility that they have.
Right. And then, you know, of course, if you have insurance, we won't want you to have to use it.
Right.
Yeah, so, and that's part of what we're trying to do here at Heartwise. We're trying to educate people that God's plan that was given us creation is the best plan.
Right.
And as we get back to our owner's manual, we're going to have less of this stress that causes disease and having us to use acute modern medicine. Well, let's answer some questions. The first one comes from Idaho. And this lady says, I'm 85 years old and I'm very concerned about the new health care overhaul. If I disagree with what's going on, what can an 85-year-old do? And she wants to know, how do you think Obama's health care plan might affect me? And I know that there's not answers to these right now because it's still morphing. Can you help this concerned 85-year-old out? How can she get involved?
Well, a lot of ways. When we're dealing with the government, from my perspective of having worked on Capitol Hill for greater than a decade, the number one thing that makes a difference for members of Congress is when they hear from people back home.
Okay.
So first of all, she needs to be contacting her member of Congress, her senators from her state, and letting them know what her concerns are. Whether those concerns are ration care, whether those concerns are what type of care she's going to get as an 85-year-old, what the costs are going to be, whether or not she is interested in some type of government-sponsored health care plan. You know, that's been kind of the buzzword. We get some government care. I like the saying that I've heard that when you get government care, you would have the efficiencies of the post office and the compassion of the Internal Revenue Service. Oh. That's we don't want that. No offense to anybody
that works there.
That's
right.
But in those situations, government care is not really what we want because, again, that's de-emphasizing that personal responsibility. If we're depending on someone else to do it, we are lessening what we're willing to do ourselves.
Right.
So in this situation, I think, one, she should concentrate on contacting her representatives, and secondly, she needs to really think about what she wants to say to them. Very specifically lay out what her thoughts are. And I think that comes through prayer, through her understanding long-term what she would like to accomplish and see accomplished, not only for her, but for her children, grandchildren, and those to come.
So let's say this 85-year-old probably doesn't have a computer, has a telephone, looks it up in the phone book, makes the call, talks to her legislator. The legislator blows her off. Okay, just says,
let's hope that doesn't happen.
No, but doesn't listen, or pretends to listen to her needs, but doesn't really. She doesn't get anywhere. Right. What would the next step be?
Her next step then is...
Should she pick it?
Well,
riot?
She could. She could. And you know, in this whole debate that we're having on healthcare right now, a lot of people tend to forget what happened in the late 80s and early 90s. If you recall, Jim, and that's probably about the time you were entering into medicine, there was a bill called the Catastrophic Healthcare Bill. It was passed to basically cover catastrophic illness for those that were on Medicare, Medicaid. And the problem with it was that the premiums were going to jump so substantially for those folks that it really was creating a hardship for those people. And they did pick it. And I remember the first couple of years I was working on the Hill, here's these people out there on their walkers and their canes, and they are just picketing, got their signs, cane in one hand, sign in the other. And you know what happened? Congress came back and repealed the law and said, we can't put this kind of burden on these folks. So we may laugh about her picketing, but it does make a difference.
But you know, and it gets back to, again, personal involvement in your health and in controlling this. Another great example.
And I don't want politicians making decisions about my health care. And I think that's the gist of what her question is.
Right, I think so. Well, our next question has to do with retirement funds, and we're going to tackle that right after our short break. We will be right back to answer this question about retirement funds after this short commercial break.